Hello, everyone, and welcome. Excuse me. Hello, and welcome to this audio podcast. This audio podcast as part of the Chromulin series. This audio podcast as part of a Spectro integer, and this audio podcast as part of a Storm Robotics production. And today's audio podcast as part of this Chromulin series. I look at Haematuria. I look at Haematuria and in context of imaging. So imaging being sort of radiological sort of similar investigations. So it's important to sort of substantiate the sort of differential diagnosis through some of the preliminary investigations through laboratories, and then imaging or radiology. It is important to additionally to carry out imaging or radiological investigations, and especially if reoccurring or progressive hematuria is evident. So the following exploratory modalities are used or have been used to evaluate and validate a diagnosis in regard to hematuria and severity. So initially, sort of plain radiography being an X-ray. Secondly, through cytoscopy, cystoscopy, and thirdly, through ultrasound. Fourthly, through intravenous urography. Fifthly, computerized tomography. Sixthly, in magnetic resonance imaging, and seventhly, sort of renal biopsy, but only warranted when there is a clear indication of renal insufficiency. That draws this audio podcast to a close. This audio podcast as part of the Spectro integer, this audio podcast as part of a Chromulin series, and this audio podcast as part of a Storm Robotics production.